Here are some home remedies for sensitive teeth. Use a desensitizing toothpaste that contains fluoride or potassium nitrate. Brush your teeth gently with a soft bristled brush and avoid using toothpaste with harsh abrasives. Use a toothbrush with a smaller head and a rubber tip to gently brush the sensitive areas. Rinse your mouth with a mixture of equal parts water and hydrogen peroxide. Avoid or limit foods and drinks that are high in acid, such as citrus fruits and carbonated drinks. Avoid grinding your teeth at night by wearing a night guard. Use a straw when drinking cold drinks to avoid contact with sensitive teeth. Avoid smoking and limit alcohol consumption. Consider taking over-the-counter pain relievers, such as ibuprofen or acetaminophen, if pain persists. Visit your dentist regularly to ensure that there are no underlying dental issues causing your sensitive teeth. Toothpastes contain fluoride or potassium nitrate, which can help to reduce the sensation of tooth sensitivity by blocking the tiny tubules, tiny channels, in the dentin layer of the tooth that are responsible for transmitting pain sensations. It can take several weeks of regular use before you start to notice a difference. Soft-bristled brush. Brushing your teeth gently with a soft bristled brush can help to avoid aggravating sensitive teeth. Also, avoid toothpastes with harsh abrasives, which can cause further tooth erosion. Rubber tip toothbrush. A toothbrush with a smaller head and a rubber tip can be used to gently brush the sensitive areas of your teeth. Hydrogen peroxide rinse. Rinsing your mouth with a mixture of equal parts water and hydrogen peroxide can help to kill bacteria and reduce inflammation, which can help to reduce tooth sensitivity. Acidic foods and drinks. Avoiding or limiting foods and drinks that are high in acid, such as citrus fruits and carbonated drinks, can help to reduce tooth erosion and sensitivity. Night guard. Wearing a night guard can help to prevent tooth grinding, which can aggravate sensitive teeth. Drinking straw. Using a straw when drinking cold drinks can help to avoid contact with sensitive teeth. Smoking and alcohol. Smoking and excessive alcohol consumption can both cause tooth erosion and sensitivity, so it's best to avoid or limit these habits. Over-the-counter pain relievers. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help to relieve tooth sensitivity pain. Regular dental visits. Regular dental checkups are important to ensure that there are no underlying dental issues causing your sensitive teeth. Your dentist can also help to identify any oral hygiene habits that may be contributing to your tooth sensitivity and provide additional treatment options. It's also worth noting that if your tooth sensitivity is caused by a cavity, gum disease, or tooth wear, treatment is necessary to address the underlying condition. In those cases, a visit to the dentist is highly recommended.